Hi, my name is Abby. We provide privacy and wash our hands. I'm going to be your nurse today. The doctor ordered us to do a full head-to-toe assessment. Can you give me your name and date of birth?
Jackson Italians, 110201.
Okay, can I just check your wristband? Alright, perfect. So, looking at you head on, you look very well kept. You look very making eye contact with me. Your hair looks like it's free of dandruff. Are you having any skin, hearing, vision, any swallowing issues, anything like that? No, okay. So I want to do your neurological assessment real quick. So can you repeat your name for me again?
Jackson Italians.
Okay, so you already know where you're going.
The hospital.
Okay, history here.
2025.
Yes. And then, do you know who the President of the United States is?
Donald Trump.
Okay, so your Orrington times 4. I want to go over the Glasgow scale, and that's basically the kind of scale we do it on all patients. You would score at a 15 because you're very alert. We check eye reflex, we check we check movement, and we also check sensation. So it looks like you have good eye movement, you got you're mobile, you get up, you do everything you need to do, and you have sensation in your body. Okay, and then I need to ask you, are you experiencing like any, are you feeling forgetful? Like, do you have any short-term memory loss, anything like that?
No, ma'am.
Okay, perfect. All right, now we're going to go through your head. We're going to start with your head first. Look at your head on. Your head looks round, free of deformities. Is it okay if I touch you? Okay, touching your head. I don't feel any deformities, any lumps, anything like that. Your face is symmetrical. Your eyes are symmetrical. Everything is symmetrical. Have you experienced like any headaches or any drooping in your face? That is recently.
Not like me.
Okay, now we're going to go with your ears. Just turn your head that way. Okay, your ear is equal to your eye. Your trays and look on the other side. Your eye. I'm going to do a whisper test real quick. I'm just going to stand a few feet back. And I'm going to repeat 3 words, okay? That sounds good.
Dog, cat, and mouse.
Okay, perfect. Now I'm going to come over to the other side.
Steak, chicken.
Alright, perfect. And are you having any like recent hearing issues? Have you noticed like, I didn't see any drainage in your ears either. Have you noticed any drainage or anything like that? Okay, perfect. Now we're going to do the eye assessment. I'm going to curl. When I'm looking at your head on, your eyes are round, your pupils are round, they're even. Okay, they're at 4. Now I'm going to do for light reactivity and then blow out. You can move her. Do you understand that? Now I'm going to do a combination. I just want you to look at this pen and then I'm going to
Oh, no, you're good. She's perfect. Yeah.
Your eyes dilate from what we're doing. Perfect. And are you having any sight issues or anything like that? Okay, no drainage from your eyes, that might be new. Okay, now I want to do your nose assessment. Can you do nose patency? You're just going to hold one nostril and breathe in for me. Okay, now the other one. Okay, perfect. And I will put your nose looks even. I don't see anything like that. Are you having any trouble smelling or anything like that? No? Okay, now we're going to do your mouth. Can you open your mouth for me? Okay, patient has all his teeth. I see no visible cavities. Your lips are pink, no white spots. Everything is all your mouth and everything is pink. Hey, this is me. Can you swallow for me? Okay, you have the swallow reflex, your throat's nose line and everything. Are you having any trouble like swallowing, or have you noticed any white spots in your mouth or anything like that?
I have none.
Okay, perfect. Alright, so we're done with our head exam. Now we're going to move on to our cardiac exam. Oh, and then I do want to check your skin. I just want to feel this. Okay, you do feel warm. When I felt your head, you felt warm. I want to check skin turtle real quick. I'm just going to take this out of your hand. Okay, you look very well hydrated and everything. Alright, perfect. Now we can do your cardiac exam. So before I do anything with my stethoscope, I'm going to check for your capillary refills. I'm going to assess your nails and everything and check for edema. So I don't notice any edema on your arms. We'll pretend his pants are off, but they're not. I don't feel any edema on your legs. Okay, I'll just see your nose.
And
Okay. Less than 3 seconds. Less than 3 seconds. I don't notice any clubbing. No, that's look good. Everything. Now we'll check on your feet. Alright, less than 3 seconds. Less than 3 seconds. Alright, perfect. Now we're gonna because that way I'm gonna look for JV. Alright, so everybody knows there. This way? Yes. Alright, there. Perfect. Now we're gonna check your heart sounds, okay? Alright, we're gonna go with your aortic first.
The doctor ordered for me to do a visit.
right now I'm going to assess your wrist.
So, we're gonna start off with the
Okay, place it down.
which is a couple questions to test your level of education. So, could you tell me your
And
name?
now while I'm here, I'm gonna count your apple pulse.
So, she's your sense of person. Can you tell me the president?
Alright, I'm going to
Okay, can you tell me what you're doing today? Okay, can you tell me where you're at? Yes. Okay, so the patient is ordering 10 times 4. So as I'm doing that, I'm looking at my patient to check her hygiene, which is good. She's dressed appropriate for the weather. Her skin, glancing at her skin, looks good. Everything is in check. So I will check for her temperature. Her temperature seems good, and while I'm at it, I just go ahead and assess for
and
edema.
you don't have any arthritis.
No edema.
Okay. Alright, so your range of motion is
Go ahead and
with,
check for the capillary.
I do want to employees,
And I would also check for clubbing or anything in the fingers, any clubbing. So now I'm gonna start off with the head. I will check everything symmetrical, no bumps or anything. The hair is
Alright,
clean.
and before we go to the cardiac assessment, are you having any like heart pains, chest pains,
So
anything like
now
that?
No.
Okay, perfect. Now we're gonna do, before that, I just wanna say, when we use our diaphragm, we're just listening to your heart sounds, but when we flip it over to use the bell, that's the S3 and S4 sounds, and like, so you just listen at it, if you hear like an abnormal heart sound, like a murmur or something, that helps us
either
get
of
better.
the ears, no
Alright, now we're gonna
scratch,
move on to,
so now
our
we're gonna go
respiratory
down
part of
to
the assessment. I want to check your breath sounds, but first I want to notice the depth of your respirations and your rate. You look like you're breathing well. You're not short of breath, anything like that. You're not like hyperventilating, anything of that nature. Your chest cavity looks even and all that. So let's check your lungs. Let's see what those sound like. So you're right upper lip. Take a deep breath every time.
for reaction to light. So I'm going to test
Left and right.
and if her eye does constrict, constrict bilaterally. And it does. Okay, so I'm going to check the other eye.
Okay. And then put this arm to that side.
And it does. And I'm going to assess for.
Okay. Now I just want you to sit up for me. I'm gonna check your
I
back.
look at the PM.
Right upper.
Okay.
Right lower.
Okay, great. So now,
Left lower.
I'm going to check the nose for, patency.
Right.
Oh.
There's also, well, you can lay that down. I didn't hear any of the normal sounds.
Contact extra would be.
Also, are you having
Okay,
a
great.
heart
And
rate?
hearing problems? Okay.
Yes.
What about
Okay. What color is your
breathing out your
skin?
nose? Okay,
Clear.
great. So now I'm
Okay,
going to check for
perfect.
nose patency.
And then I also want to go
Can you
over
hold one
and
nostril
turn, cough, and
and breathe
breathe,
in?
and then the incentive
And do the same for
whenever,
the nostril?
you do the incentive, or
Okay,
not
any
incentive,
trouble with
whenever you
it?
do turn, cough, and
Okay,
deep breath,
great.
you're gonna
No
turn on
problem.
your side, you're gonna take a big cough, and then you're gonna
So
take
now I'm
a
going
big
to
deep
check
breath,
the
it'll help
patient
clear out your throat and everything, let the mucus and everything. And then for incentive spirometer, it's just,
Okay,
it's just this little
you have any
device, and you're gonna blow into this hole right here, and you're gonna try to get the bubble. So like this little ball up to like 750, and every, I want you to do it every hour for 10 times every hour. Don't wake up in the middle of the night to do it. All it does is essentially exercise your lungs, because when you're laying flat on the floor, a lot of times your lungs will become sticky because they're already moist, and they're, like that causes pneumonia or bronchitis or anything like that. Alright, and then are you having any shortness of breath or any difficulties breathing, anything like that? Okay, perfect. Now we're gonna do your gastro assessment. Alright, assessing the skin, I don't see any moles, any scars, any bumps or anything like that.
The aorta.
So I'm going to listen first. I'm not gonna touch it because I will wait to calculate. Alright.
The herbs. The chocolate.
You're fine. Take your time.
And the nitro.
Yes.
And then I will also
So now I'm gonna
get
copy
the everything for a meeting.
Left upper quadrant.
Okay, now we. Okay,
I
so it's
noticed you had acid bowel syndrome.
now we're trying to put the side so it says
Okay, and then are you passion conscious or passing gas? So, what was the last time you had your bowel?
Like 2 hours ago.
Okay, perfect. And are you having any bowel difficulties or anything like that? Are you having any constipation?
No.
Alright, perfect. So, and then I want to go over to your your genitalial assessment, and usually what we do is you'll have a urinary catheter, and that's just like a small tube you insert into the urethra to help with blood or urinary retention. It'll stop like having UTIs and all that. We don't have one, but I do need to ask, what's the clarity and color of your urine? Okay, is there any sediment in it? Is it like pale yellow, dark amber? Pale yellow? Okay,
Well,
perfect.
let me finish.
And are you having any issues? You're having like burning, urgency, anything like that? No? Okay. Alright, perfect. So now we can go down and do the muscular assessment. Also, when I touch your skin and everything, you feel very warm. I don't notice any spots on you or anything like that. Alright, can you sit on the side of the bed for me? Alright, perfect. So we are gonna do your elbow and your wrist, or elbow and your hand. So the first thing I want to do, flex is extension is straight and then flex is bend, okay? So flex for me. Okay, now extend for me. Alright, now with resistance. It's okay. Now with resistance. Okay, perfect. Now we're gonna do the other side. Extend. Okay, flex for me. Alright, extend. Alright, now with resistance. Okay, now with resistance. Okay, perfect. Now we're gonna do your hands. Pronation is down, supination is up. So, pronation, supination, and with resistance. With resistance. Okay, perfect. Alright, pronation, supination, with resistance. Okay, perfect. Now we're gonna do your knee and your foot. The same thing.
Okay, great.
Extension is straight, flexation is bend. So extension for me. Now flexation. Alright, now with resistance. Now with resistance. Okay, perfect. Look at the other side. Alright, extension, flexation, with resistance. With resistance. Okay, perfect. Now we're gonna do your feet. We're gonna dorsal flex is up, plantar flex is down. Okay, so dorsal flex, plantar flex. Okay, with resistance. Alright, and then our six. Alright, perfect. Dorsal flex, plantar flex. Okay, with resistance. Alright,
And I go
with resistance. Alright, perfect. Now we're gonna check your gait and your walk. Let me just scooch this back. Okay. So just watch me. What I want you to do is I just want you to walk heel to toe like this, with your arms flat down by your side. So turn around, do it back this way. And then I want you to walk heel to toe, just like this.
Gotcha.
Alright? And then back that way.
Okay, no exhibition for down.
Okay.
Okay, and then also go back and check temporary refills.
Back the other way.
Which are less than 3 seconds. And then for
Now on
the
your
skin,
heels.
I will also do a skin surgery. And then recoil. And also,
Alright, and then
I will
just
inform my
want you to
patient
stand
on
here.
skin breakdown.
Yeah, just stand with your hands on the side. Alright, you have good balance, you have a good gait. Are you
Wrist
can
skin
sit back down
breakdown
for me.
could be balance.
Are you having any issues walking? Like, do you feel dizzy when you walk, or like having issues trying to get up or anything like
and
that?
friction.
No. Okay, so there's one more scale I want to go over. It's the Braden scale, and what that is we assess you for like if you would have skin ulcers, pressure ulcers, stuff like that, skin tears. Three of the main factors is if you stay moist, if you're mobile, and what's your nutrition like. But as looking at you, looking at all your charts and everything, it doesn't seem like you have any issues. All right, so I'm just gonna check my paper real quick to make sure that I got everything.
Right lower quadrant.
Okay.
So patient ears are intact, symmetrical to face.
And then you will listen up to a minute, but if you already hear dial signs, you can move on to the next part.
Oh, I do need to let me see. I need to calculate your 4 pulses, okay? So I'm gonna feel right here. Yeah, that's 82. Now that's your radial pulse. I'm gonna look at your posterior tibula, which is down here. Alright, that's a 2, and then your dorsalis pedis. That's a 2. Okay, and then I want to go over all your flux points. Your carotid is right here, axillaries is up under your armpit, brachial is right here, I said radial right here, femoral is right here, popliteal is right behind your knee. Then you have your dorsal pedal on the top of your foot, and then your posterior tibula right here, right where you feel all your thick veins. And other than that, your skin looks in good color. Can you lay down one more time? I do need to listen to part of your sound. Your vascular sounds in your mouth. So just lift your stomach back up for me.
And then extend.
It's just right.
Okay, and flex with pressure. And extend with pressure. Okay, that's good. Full range of motion on the right side.
I don't notice any swooshing. Everything looks good. Do you have any questions for me?
No, ma'am.
All right, perfect. Well, I will let the doctor know, and then he'll get back to you, okay?
Okay, great.
Thank you.
Range of motion in the